everybody. My name is Becca Ironside, and I'm a pelvic health physical therapist. So I treat a lot of men and women for pelvic health concerns. And what I've noticed through the years is that there's no shortage of females flooding the gates of our office. They need us, they know they need us, they come and they get the help that they deserve. What we have, however, is a shortage of men coming to our office. And that's not to say that they don't need us, but that is to say that men had a great reluctance to oftentimes address their health, especially as it relates to the pelvis. So I was scouring the internet for other like-minded people, and I came across this unbelievable man named Waverly Willis, who is a barber in the great city of Cleveland, who has begun a mission to address men's health in his barbershop. Take it away, Waverly.
Hello, everyone. Like she said, my name is Waverly Willis. I'm a barber in Cleveland, Ohio, and I am the executive director of a nonprofit called the Urban Barber Association. And through the association, we do various programming dealing with literacy, homelessness, and one of our bigger initiatives is men's health, specifically blood pressure. And as of recently, we're working on a program to look into prostate men's health, which is, I guess, how we came to this moment. So I appreciate you having me on.
Thank you. I'm blown away by your initiatives and the things that you've started. As pelvic floor physical therapists, we know that blood pressure can affect other bodily systems. So we actually treat a lot of men for erectile dysfunction and prostate cancer. The issue with erectile dysfunction is that it can be very tied to an underlying cardiac problem. And oftentimes men are not going to go to a urologist and get their Viagra or Cialis. They might simply go online. So they're putting a Band-Aid on the erectile dysfunction problem, but no one is looking at their cardiac status. And I wanted to ask you, Waverly, how often have you been the first person to alert a man that he has high blood pressure?
Well, this began many years ago. I began seeing some of my clients not show up, and I would run into a wife, a daughter, son, a family member at the local grocery store or the neighborhood cleaners or something to that effect. And I would ask, you know, what happened to Joe? What happened to Mike? And they would say, well, he passed away because he had high blood pressure, but he always felt fine, so he never took his blood pressure medicine. Or he had diabetes and he just would not take his insulin. Or, you know, he had various health problems and he just wouldn't go to the doctor. Unfortunately, the big thing across the board with men is we don't go to the doctor unless something is falling off. But by then, it's falling off. You know, it's too late at that point. You know, so I took it personal when my clients would start to disappear. And I know that I had some type of influence over these men just by having conversations. I'm going through the same problems, you know. I struggle with high blood pressure. I struggle with obesity, pre-diabetes, and a myriad of other things that's common in men my age, and specifically in Black men. So I just began having the conversations with the men about, well, what, just out the blue, what's your blood pressure? And I found out that, number one, men, for the most part, don't know what their blood pressure is as far as the numbers go. They don't know what a good blood pressure is versus a bad blood pressure. They have no idea. And so that's when I took it upon myself to connect with Cleveland Clinic, Metro Hospital, University Hospitals, 3 of the major hospital systems here in Cleveland. And I just started having the conversation. And like yourself, they have the same problems. It's been a head scratcher for them for years. So I just invited them in. You know what? Just come into my shop once a month, and let's just start taking blood pressures. And through the years, we started to kind of streamline it, and it got to the point that our goal for the program was three different things. We wanted to screen, educate, and refer. So myself, I'm never, me myself or the barbers that I deal with, we specifically are trained. We're not giving out any medical advice. However, I know me and I know my story, so I can say, well, you know what? Uh, I was having some problems in the bedroom with my significant other, with my wife, and these are the conversations that we don't want to have with you women in the room, but they are had. Referring to what you said about buying the sexual performance enhancement things off the internet. That's a great segue into, all right, that's great that you bought the Viagra, the Cialis or whatever, and now you can perform, but we need to dig a little bit deeper as to why you could not perform and why can't you perform without these performance enhancers. And so I always get men to open up by sharing my experience. I'm also in recovery, and in recovery, we have a saying that a problem shared is cut in half. I don't have all the answers, and quite honestly, I get a lot of the answers from the gentlemen in my shop, and so that's how we start having a conversation. I have a barber, one of my barbers, he survived prostate cancer. And so I've been encouraging him since that. And, we went through it with him. He was tired, he was just withdrawn, because that process takes a lot out of a man. And so while he was going through the process, we're getting real time, what this man is going through as he's trying to come to work on the days that he felt up to it. And he's sharing this experience. We started to catch fire, and my proudest moments is on a Saturday morning when it's a barbershop full of men, these macho guys, and we're not talking about the Browns or the Cavs. We're discussing vegetarian lasagna recipes and a yoga pose that we finally got. You know what I'm saying? So those are my proudest moments.
I
So
love this.
that's the story in a nutshell as to how I started taking blood pressure. And now it's to the point that I can recognize the signs. So if a guy's in the chair and he's sweating profusely, bad sign, or if a gentleman comes in and the last 3 times that I've seen him, he has to come and he got to go straight to the bathroom. He got to pee first, that's a sign. So I already know while he's using the bathroom, that's my segue. Bro, the last couple times you've been here, you had to go straight to the bathroom and pee. Oh yeah, man, I don't know what's going on. I just gotta pee all the time. That's a sign, and that's the segue into it.
I love it. And speaking of scared straight, it's true that fear is a very powerful motivator, but it is
Mhm.
you have to kind of get past that. And part of these conversations are normalizing these topics. This is what you're doing for these men. You're normalizing these everyday health concerns and
Right.
taking the fear out of the equation. You're mollifying it. I wanted to ask you, in reading about your amazing life journey, I learned that you were
Mhm.
diagnosed with kidney cancer. So
Yes.
I wanted to ask you your first and primary emotion upon diagnosis. How did you feel?
It's, it's funny when the doctor called me and told me that I had kidney cancer, I started laughing because I thought you ever saw the show Punk with Ashton Kutcher?
Uh-huh.
Uh, I thought someone was playing a practical joke on me.
Yep.
And so I'm laughing, but this doctor on the other side of the phone is not. And I'm like, okay, wait, are you serious? And he was like, yes. And so uh, at that moment, of course I'm terrified. I can remember my heart beating and beads of sweat starting to form on my head because cancer is serious. But unfortunately, I can speak for me. I was one of those people that would say, nah, that wouldn't happen to me.
Mhm.
But then hindsight is 2020. Why? What makes me so special that I can't get cancer? You know,
Mhm.
especially with all the crazy things that I've done in my lifetime.
I love it so much. I mean, this is phenomenal work you're doing. It really is incredible. Um, I wanted to next talk about some facts about prostate cancer because we treat
Mm,
men following prostate cancer. They might have either had surgery to remove their prostate or some radiation, some proton therapy, and the resultant issues for them can be urinary leakage and erectile dysfunction. So
mhm.
it really makes sense why a lot of men would want to avoid probing into their prostate health if they're aware of these side effects of the treatment. So we see a lot of people with very high PSAs, which is the prostate specific antigen. They know they're high and they refuse to go back to the urologist because they're afraid of the bomb that's going to be dropped on them next, which is addressing the cancer. And you know firsthand what that emotion feels like. So, some
Right.
risk factors for prostate cancer. Number one, it is the secondly most common diagnosed in the United States. Skin cancer is the first and prostate's the second. So there are so many men out there who really do need the help and we want them to get it.
Mhm.
Secondly, being a Black man or having a first degree relative who's had prostate cancer, that would be father, uncle, brother, puts people at a very, very high risk of developing prostate cancer. And so that's why
Right.
this, right, the screening really, in my personal opinion, if you have any of these risk factors, you should start getting your PSA levels checked at age 40 and up. Just keep an eye on it. Um, yeah, anything you'd like to add to that?
Well, we just have, you said that they don't want to go to the doctor because they're afraid of the bomb that may be dropped on them. But the thing is, the bomb is going to be dropped on you regardless, bro.
Thank you.
and, and so we're approaching this thing with common sense because I don't know, a common misnomer is, well, it just seemed like as soon as you find out, that's when things start going faster. But I'm like, it's better to approach it from a knowing than just literally having the bomb literally dropped on you, you know, and you're destroyed. So let's try to be proactive versus reactive.
Mhm.
Again, we just having some common sense. You know, when we got to call people out for saying ridiculous stuff, we will at the shop. You know, and I mean I guess that's what the environment is for. We go shoot it straight from the hip. We gonna have our arguments and debates, but like you said, numbers are numbers, facts are facts. So
Yeah.
um, whether you go and find out or not, if you got cancer, you got cancer.
Yeah.
You know what I'm saying?
Yeah.
And let's just deal with it.
I
And
love
so
it.
that's again, conversation.
Yeah.
Conversation is key, you know, and sometimes it's easy to go into battle when you know you have people beside you or people that have, number one, been where you're at, or number two, willing to go in the fight with you.
Yeah, for sure.
And so it truly is strength in numbers, and knowledge truly is power.
Yeah. You know, it's interesting when I treat a man for after his treatment for prostate cancer, he'll tell me all manner of things that he's never told anybody. And I basically say to him, your partner would love to hear this. And they're like,
Right.
no, yes, your partner
Yeah.
would love to see this side of you. Why don't you
Right.
go home and start that conversation? So I love it. Speaking of partners, you and I had a discussion. I called you on the phone and we talked about how women drive healthcare in this country,
Mm-hmm.
which is the statistics are pretty obvious that it's women who are going to address their significant others or their father or the men in their lives and drive them to go and get checked. So my question is, have you ever gone behind a client's back and spoken to the woman in his life to allow that man to get on the ball?
Yeah, absolutely. I went behind my client's back to tell a wife or a daughter, the things that we've been speaking about. Of course, I don't tell all of our conversations, but the things pertaining to health, he tells me he doesn't take his medication because he feels just fine. So I'll tell him, look, I need you to put your foot on his neck in the night or in the morning. I need you to stand by him and watch him swallow that pill, and or vice versa. They'll come to me, out the blue, or call me out the blue. I mean, I'm so easy to find, and they'll say, look, Mike, Joe, wow, whatever the client's name is, he's coming in Friday at 2:00. He told me he got an appointment. He has not been taking his medicine, or he has been eating like a damn maniac, pork chops, and and I mean, things happen. So yeah, I'll tell on them and vice versa, because we love them. And I mean, I've had some of my clients over the years saying, that wasn't cool,
Yeah.
that you called my wife. But I'm like, look, man, your wife is my friend, you're my friend, and I did it for a reason. Are you taking your meds? Well, yeah, because she's nagging me to death. Well, good. That was the point. So just take your stuff. Now I'm watching. Now she's watching, and now don't make me call your daughter. You know what I'm saying? So sometimes you got to come at a man from all angles. Again, I don't know why this just been a head scratcher for me, for you, and for other healthcare professionals, that man, we just don't go to the doctor unless something is falling off. And so that's why when I initially started doing the blood pressure, we wanted to screen, educate, and refer. And the refer part is, the goal is for him to start having a long-term relationship with a healthcare professional. I've seen it. I've seen the grumpy old black man say, all right, just take the damn blood pressure. You know what I'm saying? And then that's when the conversation is had: screening, educating, and referring. Even we want to take away all excuses, even if they say, I don't have insurance, which is unfortunate, but it happens quite often. Okay, here's a number to call. You know what? I got your number. I'm going to have her call you, because we're going to get you screened, educated, and referred. So
Talk about,
sometimes we
wow,
got to attack them from all angles.
this is amazing. This is so unreal. I love everything about the program and what you're doing. And I wanted to read something that you wrote for a website called prostatecancer.net, which really sums everything up about this interview here. So this is a quote by Waverly Willis. The barbershop has been a meeting place for men since Egyptian, Greek, and Roman days through to the present day, and will continue to be. It is familiar ground that men are comfortable in. This type of organic environment is important because it brings about honest and candid conversations regarding life. There is no place like the barbershop for men.
That's it in a nutshell.
Now, this has been wonderful. I really want to thank you for your time, Waverly. Again, keep on doing what you're doing. We love you. The world loves you, and you are a warrior. So thank you so much.
I appreciate it. And if there's anything I could do, I would love to, I don't know, maybe come out there and try to wrangle up the barbershops in your area, just having a conversation. Like, I would really love to expand the Urban Barber Association, because we are definitely seeing numbers. One last story, as far as the blood pressure program. We've had men on more than 5 occasions that their blood pressure was so high that we've had to have them skip the haircut. They would come in for their haircut appointment, but it's like, bro, your blood pressure is 190 over 185, and we've had them go straight to the emergency room. And I've had these same men, or a wife or daughter or son, come back and say, man, thank you. You probably saved my life. Like, they didn't even know how I got to the emergency room, how I've been driving around, how I've been functioning. So I'm seeing the numbers, and we are making a difference right inside the barbershop. So if it's anything that I can do to come out there and just have conversation with the barbers out there, I'll be more than willing to do that.
Fantastic. It'll be you and me
All right,
together across the state of Florida. We'll hit all
let's
the
go.
barbershops. Yeah, let's take the show on the road. All right. Listen,
Sounds
thanks
like a
a
plan.
million. Thank you so
All
much.
right. Have
All
a
right.
great day.
You too.
Bye bye.